Infertility in general affects about 1 out of every 8 couples. About a third of the time it's due to female factors, a third of the time it's male factors, and a third of the time it's some combination of both. One thing we always try to determine is what is the underlying cause. Depending on the cause of infertility, there can be many different ways to treat it.
The majority of patients have what we call idiopathic or unexplained infertility. We often cannot find the reason for their infertility. I've seen couples who have been trying for 5 years, 7 years, 10 years.
2.5 years ago, we realized that it wasn't happening easily for us. And we attempted a round of IUI, which was very stressful. They needed to give me these very expensive hormones.
$150 a vial.
And my body just wasn't responding. And they kept upping the dosage, so at the end we were on 3 vials a night. Needless to say, I went from not responding to being overstimulated, and then they recommended that we just abort the whole month.
In the course of about, I would say 6 weeks, we probably spent about $10,000 for just a chance to get pregnant, and that is a mind-numbing amount of money.
I think one of the biggest problems is how expensive infertility treatment is. It's rarely covered by insurance. So I think that's one of the most trying parts of the whole journey.
You really don't understand until you've been through it. The burden that it puts not just on you as an individual, but as a couple and on your relationship. The life that you envision for yourself, the family you want to build, all of a sudden that may not be a possibility.
This often makes the idea of having to do multiple cycles or months of treatment really burdensome and sometimes is prohibitive from families achieving their success.
Honestly, if we had not met up with Empower, I don't know that we would have repeated that. I was not up for repeating the last episode of what we had been through.
As a fertility physician, one of the hardest things for us is the dichotomy between who can afford care and who cannot. And we love that Empower Pharmacy is able to provide medications needed for IVF at lower price points and open up that access to care so more couples can have families that they dream of.
Empower Pharmacy, they've given me therapy that is available to everybody at a price and of a quality that can be appreciated both by myself and my patients. Whereas before it could only be for those who can really afford it. Most of your compound pharmacies are very small, but Empower Pharmacy is not a mom and pop shop. It is a big, smooth running, detail-oriented organization.
Empower Pharmacy knows that fertility treatment is really stressful, so whenever someone prescribes with Empower, you have a dedicated team just strictly for those infertility meds. You have our call center representatives, a fertility program manager, we have pharmacists that are strictly trained on fertility products, and we do have dedicated account managers for any questions any patient might have.
The experience interacting with Empower is totally different than any other pharmacy that I've ever interacted with. What Empower has done is completely change the way that I deliver healthcare. Now we're able to offer couples a chance to become parents when they never would have had that option. 1 out of 6 people walking down the street is gonna have an issue with fertility at some point in their lives. You are not alone. There are so many people that have walked this road before. There is hope. And I think that is something that I have grown to appreciate more now than ever before.